My name is Calliope, and I'm going to be the nurse who's taking care of you this evening. If you wouldn't mind, I'd just like to sanitize my hands real quick. Make sure everything's clean. So tonight I'm just going to be doing a little assessment before you go to bed. Now, I tend to use pet names a lot, but I do like to ask if that's okay with you. Some people don't like that at all. I'm one of those people who likes it when I'm out and about and little old lady calls me hun or something like that. So if that's not cool with you, it's no problem. Okay? Alright, very good, thank you. So let's see what we've got for you today. Alright, would you mind just confirming your name and date of birth for me? Okay, and would you mind if I look at your little ID band? Yep, just confirming. Okay, good. And is this your preferred name? Okay, and how do you like to be addressed? Okay. Wonderful. So, do you have any allergies at all? Okay, I didn't see any in the chart, just want to make sure. So, as you've been talking, I can tell that your airway is unobstructed. As I've been looking at you, your breathing has been nice and even. Does that sound right to you? Not having any problems breathing? No, okay. And when I checked your ID band, your skin was nice and warm, so looks like circulation is good. And we will look a little more at that. We'll look at the color when we look at your hands, look at your legs. So you are awake and alert for me, which is very good. I'm going to ask you a few questions to make sure that you are oriented, time, place, person. You've told me your name, you know who you are, so that's person. Do you know where we are? Okay, good. And what brought you to the hospital? Okay, good. So you know why we are here. Good. And do you know what season it is? Good. And do you happen to recall the date, or do you know the date that you came in at least? Very good. Okay. That is correct. So I'm going to do a little safety assessment real quick. So I'm going to take a look at you. I see you have an IV, so we'll look at that. I'm going to look at the machines. We'll look at the room, okay? Just make sure that there's nothing unsafe, right? Okay, excellent. Thanks, hon. All right, let's take a look. Let's look at your IV here. Okay, and then we'll look at the tubing. Make sure that's all straight and there's no compromises in it. And it's all hooked up to the pump correctly. Now let me just check. Let me just check your records real quick. Make sure we have. Okay, let me look at the bag and make sure that's the right. Okay, that's the right medicine. And then we look at the pump settings, and that looks correct too. Good. Okay, and do you have your call light right here? Okay, so it's well within reach. Good. Right, just looking around you, seeing if there's anything in the way, anything on the floor. If there's anything out of the ordinary. Immediately. Okay, and there's nothing left out. Looks like so far you've been taken care of quite well. How's your stay been at the hospital? Yeah, I know, it's not fun at all, but if we can make you as comfortable as possible, then that's ideal, isn't it? You just let me know if there is anything I can do for you, okay? Make you more comfy. Besides jailbreak you out of here, of course. Yeah. All right. Okay, I think everything looks good. Good. I don't see anything out of place. So, now let's take a look at your physical assessment. So, I'm just going to note off, I have a little checklist just to make sure everything is getting taken care of, that we're very thorough. Alrighty, honeybun. So, let's look at your face. So, I'm going to look at your facial symmetry. Make sure everything's in place, that we don't have any drooping or any muscles that aren't responding, that there isn't anything out of the ordinary. Now, if you wouldn't mind just giving me a smile. Yep, then I can look at the eye muscles, I can look at the muscles around your mouth, cheeks. Your whole face moves when you smile, so that's a good little quick test. You have a wonderful smile, by the way. I don't just say that for anybody. Very good. Okay, you can go ahead and rest your face. Right? You don't need to keep smiling. Good. Let's see. Very good. Okay. So if you wouldn't mind just looking to your left for me, so that would be this way. You can look to your left. Good, and look to your right. Can you look up? And look down. Wonderful. Okay, and just as a little bonus, I want you to follow this finger and we'll check the diagonals, okay? Follow this finger using only your eyes, without moving your head. We'll go diagonally up, diagonally down, diagonally down, diagonally up. Good. Diagonally up, diagonally down, diagonally down, diagonally up. Okay, and just follow the finger as it comes in and out. Good. In, out. Good. In, out. Okay, and let's switch. Keep following as it comes in and out. In, out, in, and out. Very good. Okay, so let's take a little look at your mouth. Let's see, where's there's my pen light. Too many pockets for my own good. I'd lose my head if it wasn't attached to me. Now, if you wouldn't mind, I'm just going to take a look at your mouth, Okay. Just checking the color of the lips, making sure that they look like they have good circulation, that they're not blue or overly dark or pale. Okay, and if you wouldn't mind opening your mouth, just gonna check a couple of things here. Look at the oral mucosa. Good. And if you wouldn't mind showing me your teeth, I can look at the teeth and the gums. Good. Okay. And would you mind sticking out your tongue for me? Good. And can you move it up, down, to the left, to the right? Good. And can you lift your tongue to the roof of your mouth so I can look at the bottom of your mouth? Good. Okay, fantastic. You can go ahead and put your tongue resting neutrally. And let's take a look here. Very good. So now we're going to do our examination of the chest. This will include inspecting the chest, looking at how you're breathing. We'll take a little listen with the stethoscope. We'll listen to your heart and to your lungs, okay? So if you wouldn't mind, I'd like to lower the gown just a little bit so I can reach the chest easier. Okay, from this point forward, I will need to be touching you. Is that okay with you? Do I have your permission to do that? Wonderful. So let me adjust. This. Okay, good. And let me just grab my stethoscope, make sure I have it. We're not fumbling for it. And just going to watch you as you breathe. I just want to watch the rise and fall of your chest. Have you had any trouble with breathing, any trouble with chest pain, shortness of breath? No. Okay, good. So that's looking pretty good. So now we're going to do some auscultation. And for auscultation, we will be listening to the apex beat primarily. So your apex beat is going to be the mid-clavicular line. So you have your clavicle here, right along that line, and the fifth intercostal space, which is those spaces in between your ribs, those intercostals there. So if we take our fingers here and palpate for the fifth intercostal space, and then travel over to the mid-clavicular line, and we can place our stethoscope, our diaphragm, on the chest. And you can breathe normally for this. Good. Just listening for the heartbeat and listening for the rhythm, the strength. Is it a little too fast? Is it a little too slow? And we're going to sit here for a little bit because I want to get the heart rate. So we're going to listen for full minute. I'm just going to keep track of the beats. Okay, so heartbeat sounded pretty good, nice and steady. So let's write that down. Good. And then we'll pop the stethoscope back in and we'll take a listen to the lungs. And this time I will be guiding you when to breathe, so we can see how the lungs are doing. Okay. So I'm going to go in almost a ladder-like motion. So we'll do at the top, go to the side, go down to the side, down to the side, comparing each side to the other, right? So when I place the stethoscope, the diaphragm, on your chest, I want you to take a deep breath in for me. Okay? There you go. Thank you, love. Deep breath in. And out. And again. Deep breath in. And out. And deep breath in. And out. Deep breath in. And out. Deep breath in 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 and out. And then let's check the sides of your chest. So last couple breaths here. Take a deep breath in for me. And out. Good. Deep breath in. And out. Very good. Very good. So let's go ahead and pull the gown back up, okay? There, all secure. And then we're going to take a listen and a look at your abdomen, all right? So I'm just going to roll up the gown a little bit, okay? just enough that I can see the abdomen. There. Okay. So I'm looking at the slope, the planes. Good. Just doing a little inspection. And then we'll grab the stethoscope. We'll auscultate the 4 quadrants. Okay. So we're going to start at the right upper quadrant. Okay. You can just breathe normally here. Okay, let's go ahead and move over. And move down. And move over. Wonderful. Alrighty. Now I'm going to be doing a little bit of palpation on the abdomen. Have you had any stomach pain at all? Any upset stomach, nausea, anything of that sort? Okay, if you did, we'd leave it for last because that's not a fun feeling. So I am going to be doing some medium pressure on your abdomen. We're not going to go too deep. And I'm just going to be using the flats of my fingers. We'll feel around. We'll go a little bit in a circle. Okay? So do let me know if there is any pain or any tenderness, all right? Okay, let's start right here. Okay, let's move over. Patient and cooperative. Really appreciate it. Okay, so no pain or tenderness in any of that? No. I'm gonna roll down your gown then. Get you all situated again. There you go. If you could just give me a moment. So we are going to take a little look at your arm, and I'm going to first start with looking at that IV site, rather. Got a little mixed up there. Alrighty, sweetheart, this might be a little tender. I just want to make sure that we don't have any redness or drainage, rather. No swelling. And has this been giving you any trouble at all? No. Okay. Yeah, besides the usual, I know. I've had an IV once in my life, and it is something I would like to never repeat again. I getcha. I'm just being very careful with it because I know. I'm well aware. Okay, good. So, I'm gonna look at your arms, I'm gonna check the temperature, look at the skin, make sure the circulation's good. We'll test your strength a little bit, test your sensation. Okay? Alright, so I'm just going to use the backs of my hands to feel the temperature of the skin. Okay? I'm going to compare that bilaterally. Good, nice and warm, dry. Color looks good. So I'm going to check the capillary refill on your fingernails. I'm just going to press down and see how quickly the pink returns. So we're just going to press, release, press, release, press, release, press, release, and press, release. Good. Okay, so circulation returned briskly. Very good. So let's test your strength a little bit. I'm going to have you squeeze onto my finger as hard as you can. You're not going to hurt me, okay? Let's go ahead and squeeze my fingers. Good. And now I am going to have you hold up your hands like this. I'm going to try to push you forward. I want you to resist me, okay? Good. And if you could push me forward, okay? Good. Now I'm going to hold on to your hands. I'm going to try to pull you towards me. I want you to resist me. Good. And now I'm going to hold on to your hands again. I want you to pull me towards you. Good. All right. So now let's go ahead and check the sensation of the arms. Have you had any numbness or tingling in your arms at all? Or in your fingers, your hands? No. Okay. So I'm going to have you close your eyes for me. And I am going to touch you on the arm or the hand or the fingers. And I just want you to tell me when you feel me touching you. You can just say yes. All right? Okay. Close your eyes. Good. Yes. Yes. Good. Mm-hmm. Good. Good. Okay, this time tell me whether you feel it on the left or the right side, okay? All right. Right. Left. 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 Right. And right. Very good. You can go ahead and open your eyes. Now, before I move on to the lower extremities, I'm just going to check your radial pulses bilaterally. So I'll be placing my fingers right below the thumb here. This is a good spot, but we don't take pulses with the thumb, even though it's convenient. Sometimes you can feel your own pulse and not the actual person's. So I'm just going to have you show me your wrists here. Good, and then we will check the pulses, check the strength, make sure that they are synchronized. There's no radial delay. Good. Good. All right. Let's move to the lower extremities. So I'm just going to pop myself back a little bit and let's take a look. So I'm going to manhandle you a little bit. Okay. So I just want to inspect the leg. Have you had any numbness or tingling or any sort of pain in your legs, in your feet? No? Okay. Take a look at this one. Good. We'll look at your feet. Okay. I just want to check the temperature of the legs. Good, and I'm just going to check the pulse behind the knee and on the top of the foot. We have the popliteal pulse. Checking that bilaterally. And then we have the feet. Okay, and then we're going to check the capillary refill on your toes. We're going to press, release, press, release, press, release, press, release. Okay. Alrighty, very good. So I am going to press down on your feet. I want you to resist me. Good. And I'm going to try to pull them towards me. I want you to resist me. Good. Now with your legs, I'm going to try to push them downwards. I want you to press up. Good. And now I'm going to try to pull them up. I want you to press them down. Very good. All right. So let's check some sensation then. We've checked your skin temperature and that was fine. Everything is warm and dry. Color looks good. Skin looks good. So I am going to have you close your eyes. And I'm going to touch either your knee, your lower leg, or your feet. I just want you to tell me when you feel a touch. Just say yes. Okay? Yes. 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 Good. Perfect. So now I'm going to have you differentiate between left and right. So tell me whether you feel a touch on the left side or the right side, okay? All right, ready? Right. Left. Right. Left. Left. Right. Very good. Need just a moment. Make sure we have everything. Okay, so I'm going to get a little closer again. Good. And now I'm going to have you sit up for me, and you are going to turn around. And I'm going to listen to your lungs on the back. listen to the posterior chest wall. Okay, give you a moment to get all settled. And are you finding this movement difficult at all, or does it seem pretty normal? Okay, very good. Give you a moment. Okay, and let's go ahead and listen to your back. So I am listening to the lungs. You'll feel my stethoscope all along your back. I will tell you when to breathe, right? So if you could take a deep breath in for me. And out. Deep breath in. 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 And out. Last row. Deep breath in. And out. Deep breath in. And out. Okay, and you can swing back around and get all settled once again. All settled? Alrighty, sweetheart. So I am just going to review my notes here. Are there any last things you need to add? Any questions at all? No? Okay. So just give me a moment. I want to just make sure everything's complete. Extremities. And finishing the Auscultating. Good. So I'm going to sign off on this chart. Good. We can put that away. So I need my pen back. And I need my pen light back. Your chart stays with you. Okay. I need my sanitizer. Good. So that concludes our assessment. So you shouldn't see one of us back for the rest of the night, okay? We will check in on you, of course. We'll take a little look in and make sure everything's going all right. But otherwise, we won't do the full-blown test, assessment, evaluation, what have you, until the morning, okay? So you have that to look forward to. I know it's a lot of tests, it's a lot of moving around, but we want to make sure that everything is going well. We want to make sure we get you up and at 'em as quick as possible. I know you probably want to get back to it, don't you? Yeah, on the other hand, this is kind of an involuntary vacation, isn't it? Yeah, some people treat it as such, absolutely. So, just making sure before I go, is there anything else I can do to make you more comfortable? Oh? Yeah, absolutely. I can stay for a few more minutes. It can be pretty lonely here. I get that. Well, more than welcome to just chat, or I can work on my own little bits. Just chatting. Okay, that's fine. So, tell me a little bit about what got you in here then. I have a little bit of information from what's on the chart, and I have the abridged version of what you gave me, but I'm curious how you got here. I see. Yeah, well, I mean, there are certainly some interesting things that have gotten people in the hospital, so if you ever feel embarrassed, or if you ever feel like it doesn't quite warrant the reaction, I mean, I've seen people with some things, while serious, after the fact, after they've recovered, probably they'll laugh at how they got here, and then some people don't have anything wrong with them, so it's all a little scale. So don't feel like you need to be ashamed or embarrassed. Trust me, I mean, I've seen a lot worse and I've seen a lot better. So better as in people that don't have anything going on. Okay? Yeah, I mean, it's not really that big of a deal. I promise you. Okay? So the best thing for you to do is rest up and get your strength back. And the more you rest, the faster you'll get at it. It sounds kind of counterintuitive, but if your body isn't given that time, and actually your brain as well, if it's not given that time to legitimately heal, a lot of healing is done in sleep. You have both the healing that is going on with your body and the rejuvenation for your mind. That's going to be a big part of it, so make sure to get a lot of sleep, and I know we're pushing a lot of fluids, so that one we're already staying on top of. But it's all about hanging out. You're already here. It's already not much you can do. Might as well do what you can to get better faster. And that means relaxing. Okay? Alrighty, so I've taken a little bit of extra time with you, and I will have to bid you adieu. Thank you so much for being a model patient. I really appreciate it, and I hope you get better soon, okay? Alright, I hope you have a whale of a day tomorrow, and a good rest of your night tonight. Thank you. Goodbye now. slash pseudo